If you're going to use a GLP-1 medication, the goal shouldn't be to just lose weight as fast as possible and hope for the best. I know many people are so super fixated on weight loss that they don't think about much else at first. But the real goal is to get the best results in a way that protects your health, your muscle, your emotional well-being, and your long-term outcomes. And that means thinking beyond the prescription itself. Because somewhere after the excitement of starting the medication, reality hits and you realize there can be a lot to juggle. You have to think about how you eat, how you move, and how to support your body while you're on the medication. And that can feel overwhelming. So today I'm going to walk you through how to get the best out of your GLP-1 journey. I'm Dr. Vivian Lowe, board certified in internal medicine and obesity medicine with over 20 years of treating obesity. I'm also the author of a book on the GLP-1 system, and here I break down the science, the real-life challenges, and the practical questions people have about GLP-1 medications. So let's go. Okay, so if you remember from the last video, uh, we talked about how weight loss changes your body in irreversible ways. So, you lose a certain amount of weight and you regain it, but you're not going to have the same body as you did from before the weight loss, because in all likelihood, you're going to have more fat and a little bit less muscle. Okay. That's the sad reality with losing, regaining, losing, regaining. We also talked about the best case results that we saw in the drug trials, and every single drug trial involved lifestyle modification because that has to go hand in hand with the medication if you're going to get the best results. All those people on the trials, they had extensive, intensive coaching. They had a lot of guidance in terms of nutrition, how to space out their meals, what to eat, right? And they obviously, because they were in a trial, they had so much medical supervision, a lot of proactive symptom management, and very careful titration of their doses so you don't go too fast, right? And have a lot of symptoms. And that would be the best way to keep people on these medications in a safe way. So today, I just want to go through some of the points that I think are most important if you really want to make the most of your GLP-1 medication. I've said this numerous times. You need to have someone supervise you, and you have to establish clear communication with your doctor or licensed health professional. And this means that before you start the medication, you have to talk about the intention. Everybody's thinking weight loss, just weight loss, just weight loss. But you should be asking questions about, well, how much weight is appropriate for me? And, if we factor in the muscle loss that I might get, then how do I manage this? What are the things that I need to be doing, right? How do I get in touch with you? When do we check in on each other? Or if I'm not checking in with you directly, who else in your office can I contact, right? There's a whole list of questions. I have a workbook on this, and I, list out the things that you should be discussing while you're making this decision to go on the medication, or even while you're on the medication, or you're thinking of getting off, right? There are lots of things, and the better your communication with your doctor, the better your results are going to be. So that is number one. Number two is to establish a structure for eating, hydrating, and exercise as early as possible. So how early? Before you start the medication, if possible, right? So what I find in weight loss, and I've been doing this for so many years, usually before someone starts a diet or they start a program, before they go for surgery, before they start a medication, they have a last supper. And they don't really have a last supper because they have a series of last suppers. And the thinking is, well, I'm going to be losing weight. I'm going to be in this period of deprivation. So I'm just going to enjoy myself now. I'm just going to splurge and just eat all the things I want to eat and be merry. And then I'll start the diet. I'll start the medication. I'll have my surgery. Okay. And that is not the way to do it. I'm not judging, and I totally understand when people want to have a last supper or two. But after you have your last supper, you need to build in a period where you're establishing a structure for your nutrition, for your hydration, and for your exercise. And if you can do this at least a month before you start the medication, that'd be great. So have the Last Supper and then build, right? Build from there and make sure you try to work on this structure. If you're already on the medication, then as soon as possible, get some help in building this structure for yourself. And if you are thinking of getting off the medication for whatever reason, right? Maybe you want to get pregnant, maybe, cost reasons you want to get off the medication. If you're thinking of getting off, you better start thinking about this structure. Okay? Have an exit strategy before you even begin. They always say that in business, right? If you think about business plans, they always ask you for your exit strategy. And some people say, well, no, I never want to sell my business. I want to have it forever. But even then, you go through the exercise of how do I exit this, right? And it's the same when you're on the GLP-1 medications or any medication, right? You should have an exit strategy and you should be talking about this with your doctor, right, before you even start. You say, okay, all right, I'm considering this medication and you can talk about the risks and how you get on it and so forth, but then included in that discussion, okay, when do we start to taper? When do we say that's enough weight loss? And when do we think about discontinuing the drug? Many people talk about staying on the medication forever because they're only thinking about the weight. Because once they stop, then the weight comes back on, as we've seen, right? But again, if you're not eating enough and you're undernourished, right, you might be malnourished, you might be losing nutrients and losing muscle. And long term, that could get you into poorer health, not better health. So we need to think about, okay, is there a limit? Is there a time limit? And also some of the risks, like with eye issues, if you're diabetic especially, the risk for specific types of blindness can be increased the longer you stay on these medications. So you really want to have this discussion before you begin. And if you are on the medication now and you've never had that discussion, I think that's something that you should think about talking to your doctor about. Next, what gets tracked has the best chance of improving. So, over and over again, I see people get on these medications, and the medication's just gonna do it all, right? And what did we see from the trials? No, the medication works hand in hand with supervision, with guidance, with intensive coaching, with intensive lifestyle modification. So it doesn't do it all in the trials. So why do we expect it to do it all in real life? And then we go, oh, how come I didn't lose the same amount of weight, right? Some people will find that, oh, it's so easy and I just stopped eating. But they're not tracking other things. They're not tracking maybe their nutrients, they're not tracking their hydration, they're not tracking their muscle. So if you're not tracking, then you're not going to get optimal results. And over and over again, I've said this to patients, whether they're on medications or not. I had patients tell you the story. I had a patient that came to me and she was not on medication and she was just working on lifestyle modification. And she complained that, she just was gaining weight and she didn't know why. She was doing everything. All right. And I said, well, you're not tracking. You're not logging your meals. You're not logging what you're eating. And she said, no, 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 I'm doing everything. I know what to do and blah, blah, blah. I said, just do me a favor. All right, just for 2 weeks, I want you to go back to your logging and write down everything you put in your mouth. Just for 2 weeks, come back and we'll talk about it. 2 weeks later, she came back. She'd lost 6 pounds. 6 pounds in 2 weeks. Doing what? Logging, right? And she said to me, Well, that was an eye opener. And I said, I bet it was, right? So we didn't put her on medication. We didn't do anything. All I did was just pay attention and log. And she lost 6 pounds. So even when you think you're doing good, you think you're doing okay, you could be doing better by tracking everything. Next, prepare for emotional bumps. For some people, this is easy, this is a piece of cake, and for others, it's not so. Okay, there are days when you ask yourself, is this worth it? Because maybe you're not feeling so well, you have a little bit of nausea, you feel bloated, and you just feel like, oh my God, I wish I could, eat like the way I ate before. This can happen sometimes before the holidays or before going on vacation. People start thinking about, well, what if I stop it and then go on vacation so I can enjoy some of the foods that my friends are going to have too? And then I'll start back up. So it can, there's a lot of things that will be going through your mind. And then you might also say to yourself, I should be losing more weight. And, maybe someone else who was on the medication and lost a ton of weight and had a lot of success in terms of weight, and you start comparing yourself, right? So this can be quite an emotional roller coaster, and you have to be prepared for it. Make sure you have good support. Make sure you have your bestie, involved in the journey, people who are rooting for you, who will help pick you up on those days where you don't feel very good about yourself, right? And the main thing to remember is that losing weight, even when it's with a pill or with an injection, losing weight uh, is actually a huge event. Most people think of it as a happy event, and very few people think of it as immense stress. And I'll tell you, my 20 plus years of doing obesity medicine, I find that losing weight is a pretty stressful event for most people. Sometimes you lose friends. Sometimes you find that the way you were living uh, just doesn't work for you anymore. And you can have a lot of grief around the process of all the change that is going on around you and within you. And the one thing I worry about most for my patients is this sense of quiet desperation. Now, on the outside, things might seem to be going well. They're losing weight, right? And so, even if they don't feel well, even if they don't feel themselves, and sometimes it's hard to put it in words, but there's a gnawing sense, this quiet desperation that's inside. And you look in the mirror and you just realize that even though you have lost weight and everybody seems to be congratulating you, that it can feel a little empty inside. And sometimes you feel like, oh my God, I should be losing more. And so you're desperate to try to get better results on your own, and you try to over exercise in some cases. I've seen people spiral. Okay, I've seen everything when it comes to people trying to lose weight because I've done it for so long. And this is a really lonely stage for most people. And that's what I worry about the most. And that is why I absolutely do not want people to do this alone. And over again, I'm going to emphasize when you set about your weight loss journey, whether it's from surgery, whether it's from just lifestyle modification, medications of any kind, I'd like you to make sure you have some good support around you. Okay. Now, I do have a guide and workbook, and that helps people, establish structure in their lives. And along with the guide, there are associated Q&A sessions, live sessions that you can attend to ask me questions. I am not giving personal medical advice. I am not your doctor, and I encourage you to get your own doctor. But a lot of times, just with my experience in obesity medicine, there are ways that you can structure your day, structure your meals that makes it easier for you to tolerate symptoms and also to feel better about yourself. So if you're interested, just look in the link below And if you have any questions, then write to me. I do try to respond to my YouTube comments. All right, take care. Bye.